Hi, thanks for watching another show on LatinoGraduate.net. I'm Aaron Sanchez, your host. It's common knowledge that we have a shortage of nurses, but what about our doctors? Well, to help us answer that question, we are honored to have Dr. Andres Jimenez from the studentsofmedicine.com. Andres, good to have you.
Thank you very much, Aaron.
Thank you for coming on. Tell us, you have an online website, and that's Students of Medicine. Tell us what exactly that is.
Well, Students of Medicine is an organization. We're about 7 years in existence now, a nonprofit organization, where we develop innovative online tools to help students realize their dreams of becoming physicians one day. So it's kind of targeting pre-med students and providing them with many resources that they can use to help make them get through this path of becoming a physician one day.
Okay, so I'm an individual that's interested in medicine. I go to your site. What am I going to find specifically there?
Guidance. And that's one of the main challenges for students preparing to become physicians. It's very intense, very competitive these days. You know, if you look at when seniors graduate from high school interested in becoming physicians one day, you have somewhere along the lines of about 1 million or so students. By the time you get to senior year of college, when people actually apply to medical school, there are only about 40,000 applications per year. And so you have a large number of people who, between high school and last year of college, when they're actually applying for medical school, they just decide not to do it. Sometimes not going into medicine is the right thing for a person. They just may want to have a different type of lifestyle, or they figure out in life that they have other types of interests. But for many people, they do have that dream. And at some point in the road, they became discouraged and didn't fulfill that dream.
Okay, so well, and I want to talk about that, but tell me about yourself. Your background. How did you get all this started? But tell me about your background.
So my background is in medicine. I'm a physician. My clinical background is in general surgery. I currently work in medical informatics, which is developing tools and software that physicians use today to document patient encounters. And
okay,
so
I did not understand that.
Okay, so
forgive me.
So let me explain that one.
Okay.
So before, when a doctor would see a patient, they would write on a piece of paper, on a chart. And you can imagine after many years, there's tons of paper that would accumulate. And there's many potential problems with errors in being able to understand doctors' handwritings. And we all know that doctors don't have the best handwriting. And so,
I must be a doctor. I didn't even know it.
And so one of the new developments is to develop a kind of electronic version of this chart that not only allows a physician to document their patient encounter, but could also be used to kind of safety check the information that's entered into the chart and passed on to other providers.
Okay.
And so I currently work with a company where we develop the software that physicians will use to document their patient encounters. So previously I would see patients on a one-on-one basis, but now I've had the opportunity in developing this software that is used by 40,000 physicians and touches 5 million patients a year.
Wow, 5 million patients a year. And I'm assuming, going back to what you were saying, there's a problem with the writing, so you're also helping save potentially.
Yeah, it's a well-known fact that errors in many different, so you can imagine medicine is very complicated, and there's many places where errors can lead to consequences.
Right.
And unfortunately, medical errors or errors in the practice of medicine causes many deaths a year. From something as simple as writing a prescription that is misinterpreted,
right.
And a patient may get the wrong dosage of a medication, to maybe even sometimes getting the wrong medication altogether. Simple things that when you're writing in there and you have a person trying to visually interpret what is written versus entering something into a computer saves thousands of lives every year.
Wow. Now, and you talked about touching lives. Now, that's what you're attempting to do with the Students of Medicine, right? Because, correct me if I'm wrong, how much are you charging for the access to it?
So access to the website is free.
Okay. So you're helping individuals. It's free. You're not. So a person just has to go on there and do what? Yeah. Anything in particular?
Yeah. So a person can visit the website and register to just get into different parts of the website. And so we have a number of tools available now. One of the, besides just a regular amount of kind of advice about the SATs, advice about the medical college admission test, also known as the MCAT.
Right.
But there's also areas about different specialties. Like one of the questions that I would frequently hear from students is, what does it take to become a general surgeon? What does it take to become a pediatrician? Well, we have an entire section on our website dedicated to different medical specialties, where you can see what type of patients OBGYN physician would see, and what type of training is needed to get that type of to get to that part in a specialization for medicine. And so we have resources like that. One of the things that we're relaunching this coming year is a live talk show where I will be hosting the show and providing tips and advice to students. Students can call in, they can email questions ahead of time.
Right.
And with the experience that I've accumulated over the years in working with admissions and medicine, try to answer their questions as best as possible. And I typically invite one or two of my colleagues who are physicians who also have experience in the field to kind of broaden the amount of experience and knowledge behind the tips that we provide.
So you have the interaction from the students, the real life interaction, and that's how you, well, and that's great. We applaud you for that. We know at LatinoGraduate.net that's exactly what we attempt to do, and we hope that we can touch lives. So obviously we see a connection, and we feel that connection with what you're doing. It's not easy. Tell me about some of the hurdles maybe that you've had to overcome just to get where you're at today with the site.
It is challenging. I mean, just the career of medicine altogether, which is pretty much the prerequisite for me to be able to provide this type of advice, it's a challenging career. One of the things that I think is great about healthcare and what I'm able to do today is that, sometimes you're able to help people in need, and that person may be a person in a trauma situation who's badly injured in a car accident. And with medicine, you know how to provide them and give them help. But sometimes some people in need are kids that lack guidance, who have a dream about becoming a physician or any type of professional career, but they don't have the guidance. And so being able to help them out is another benefit, I think, that has kind of fueled my desire to do what we do today. And that's what's kind of got me past the many obstacles that have been aligned along my career.
Well, okay, so take me back to, I always ask this of everyone, take me back to yourself being young. Did you say, I want to be a doctor?
Yes, actually I did.
You did?
Yeah, so I recently ran into a friend of mine from elementary school who had our elementary school yearbook. And in there, it had written down, I want to be a surgeon, and I want to work with computers. My wife laughed about it.
How old were you?
I was like 6. It was actually, no, this was my elementary, so graduating from 6th grade on. So whatever that age was, maybe 10, 11 years old.
Wow. Yeah. So you've accomplished what you set out to do.
Yeah.
And everything has, and in fact, that's a good question. When we come to your goals and everything that you set, did you set it around that main pursuit, that goal?
Yeah. That's a very good question. I suppose so. I've always dreamed of becoming a physician, but what does that necessarily mean? When you're 10 years old, you don't really have an idea of what that really means in terms of time with your family one day, professionally, how much work, how hard you're going to have to work, what are you going to do? And even within the field of medicine, you can be in the operating room or you can be working on computers the way I am right now. And so I'm not exactly sure at what point, actually I can tell you, I never really knew that I would be doing what I'm doing today back then, but I've always had the kind of passion to want to do a little bit more, do medicine, and see what opportunities open up.